Hi, this is Junaid, neurocritical care stroke and epilepsy specialist. So we talked about scope of practice of nurse practitioner, defining them, my personal biases, what is the important questions in terms of impact on physicians, impact on care, etc. Now let's just talk about how the future looks like. Look, there are two important things that have changed within post-COVID. One is virtual care, right? I mean, you can extend a physician not just by nurse practitioners, you can extend them virtually. So that changes. And then more importantly, the development of artificial intelligence. We have new clinical decision support systems that are extremely better in terms of providing more accurate care and creating a support system for clinicians in general that can be very helpful. So we are seeing these two trends actually, in my opinion, a little more favors towards the nurse practitioner workforce, because now the trend is that physician is at website and then the advanced practice provider is at the bedside. So there are these models that are coming in. I mean, this is a teledoc talk that utilizing AP physician collaboration and telemedicine to extend care. I'm going to be honest with you, there are places that I have designed systems in the neuro ICU as well that, this is the same model when the physician is on the website and the APP is at the bedside. So again, to provide access to care, it's important. But again, these are evolving models that you should also be aware of in terms of choosing your subspecialty. And then, of course, artificial intelligence, clinical decision support, preventative care, etc., is extremely getting faster and improved as more and more data goes through these intelligent algorithms and recommendation systems in which you are able to produce more accurate patient picture more longitudinally in the future as well. And therefore the clinician training that was potentially lacking, there are now other systems that are coming up to help them bridge that gap, mainly because of artificial intelligence. And of course, in the next module, we're going to talk about virtual care, and after that, it's going to be artificial intelligence. And you can see that how it is making the difference as well. So you need to understand overall that where the APP falls within that timeline, but more importantly, how you're going to choose your medical subspecialty as well. Now, professional societies in general have had, what opinions do they have? I'm going to just use the example of American Academy of Neurology, because I'm a neurologist, but again, you have to look at that. And professional societies think that integration of APPs is a good thing. It is crucial to improving access, quality, and continuity of care. And I truly believe that personally as well, as I've told multiple times. And then they recognize the accepted scope of practice, right? They are professionals, they're licensed, they're training, and they have their abilities as well. So they actually do believe that they can fully extend the care of the neurologist as far as neurology is concerned. So AN continues to support these policies with physician-led multidisciplinary care teams. So they are sort of, copying out with a political term in terms of saying that it has to be physician-led. But as I said, I believe that a chronic epilepsy patient, chronic stroke prevention patients, etc., are important, that they can be seen by nurse practitioners, because at the end of the day, it's more about continuity of care, access to care, quality of care, engagement of care, making sure that the patient is compliant, etc., etc. And sometimes they do a better job on that, and therefore they should have an integral role. And that's what American Academy of Neurology also states. It was grateful talking to you. In the next series of lectures, we're going to talk about virtual care. Thank you.